that we have a moment available to contribute to the prevention of the spread of COVID-19, we must also, in parallel, prepare and plan for the humanitarian impact that is almost inevitably now ahead of us across 14 contexts that are incredibly tough and already fragile and conflict affected in many cases. The third is to provide physical and psychosocial protection, recognizing that a lot of the communities that we work in had pre-existing immensely high protection risks, and these are only going to be heightened by the advent of a pandemic, and that many new risks will also likely emerge. In the same breath, the promotion of life-saving and life-sustaining learning to ensure that children continue to learn during this crisis, now that across all of 14 of our context, schools are now closed, and in many cases indefinitely. It may be that we've already seen the end of the academic year for the children that we fought so hard to get into school, just at the moment when they need safe spaces and they need to access life-saving information. We're also prioritising increasing coping capacities for survival and sustenance amongst the families that we're working with, recognising that lockdown and quarantine in particular during Ebola had an immensely disastrous effect on families, the poorest families who live hand to mouth day to day, and for whom 14 days of quarantine inside a household might have meant survival. And then finally, accelerating localization and amplifying local level response. We are absolutely clear that local actors and locally led response is going to be central to Street Child's COVID-19 response, and in fact the global response at a time when a lot of the international community are immobilized. So if we can move on to the first of these priorities around prevention. You know, I think many agencies and actors are wondering now whether to suspend, whether to withdraw, or leave this to health and WASH actors, for example. And we had the same thought in Ebola. But in the end, the battle against Ebola was won out in the community rather than in the hospital. Large-scale actors will crank into gear. Health sector is massively focused on preparedness in terms of health services, but action's needed now. And we're clear that every person, every agency has a role to play in this window of opportunity we have right now to engage in prevention work. So whilst, as Ramya set out, those numbers have doubled, it's clear the caseload has doubled. It's clear that Africa and South Asia are a number of weeks behind Europe and North America in their caseload, but rapidly rising. And so what's also rapid is the closing window of opportunity to slow the spread of COVID-19. And that means there's a huge value in prevention activities right now. So we're working immediately to inject as much urgency into the national response efforts as we can by mobilizing our 44 local partners and their community networks across our 14 countries. And we started to implement a range of health, hygiene, and social mobilization measures, drawing particularly on our Ebola experience. So here in front of you on the photo, you see one of our national Nigerian partners has set up hand washing stations at critical points in settlements for people displaced by the Boko Haram crisis, so that they can wash with soap, which destroys the virus, rather than water, which is most commonly what people use to wash their hands. You know, I think it's really important to note as well that national partners are absolutely central to social mobilization. Scared, vulnerable communities listen to those they trust in times of panic, and that's why the messages need to come from those they know. Local community members empowered to deliver very basic information about how to identify, prevent, and report COVID-19. So that is really top of our priority list right now. Second in those priorities, if we come on to the next slide, is preparedness. So at the same time, we recognise that the potential humanitarian impact of this crisis is huge, and we have that same critical window of opportunity to prepare for and mitigate this impact. So we want to engage in preparedness efforts at the global at national and community level to be best positioned to respond if and when the crisis becomes more severe. And I would say that for some, this crisis is already severe. As Ramia so rightly pointed out, in the Musahar community, people are already at risk of starvation and even starving because of the lockdown measures. So at global level, we know that Street Child can share lessons of what happened and what worked when the Ebola epidemic reached its apex, and work to anticipate those needs ahead of time. At the national level, we can engage in planning and preparedness efforts. So in Uganda, for example, one of our major donors, actually, their donation allowed us to kickstart prevention and preparedness work in the South Sudanese refugee camps in the north, which are incredibly overcrowded and highly at risk. And now that's allowed us to gain a position of trust and credibility with the government and the local COVID-19 task force. It gives us a position of influence to be able to share what we're learning in other countries and what we know to be true, and what we also learn from our local partners and their feedback loops with the communities on the ground. And then finally, of course, at the community level, we need to support most vulnerable families to think through strategies to prepare for the worst and the possible effects of the crisis, such as periods of lockdown. For example, seeking where they can to store extra food and water, to find safe spaces to stay in quarantine, and to ensure that all their family members are together. So that's the first two of our really critical priorities. And I'll hand over to Ramia to take you through the next couple.
Great, thank you, Megan. So as we touched on before, we are both concerned immensely about the health impact as well as the humanitarian impact. And I think one thing we know is Street Child working across 14 different contexts in such a rapidly changing environment, given the nature at which this pandemic is evolving, is that it's absolutely critical for us to be context specific in the response we're delivering. So that might mean that in some countries, we're still in the prevention stage or in the preparedness stage, but in other countries, we've already passed that very narrow window of opportunity that Megan talked about to conduct some of those prevention and preparedness operations, and have very quickly needed to move on into a full-fledged response that looks at protection and other components that we will come on to. This is an example. What we have on the screen is an example from what we delivered in Nepal for a very, very marginalized group of girls, where we are particularly concerned about the protection risks that they face now with schools and learning centers closing as a result of the national lockdown. This particular group of girls belonging to a lower caste community group, approximately 80% of them have faced some kind of sexual violence or abuse before the age of 12. And we know that that risk is more imminent than ever with the lockdown coming into place. These protection activities were delivered within a rapidly closing window of 24 to 48 hours. And this is personally one of my favorite photos from our response so far, which shows the notebooks of these girls, where their protection advisors wrote down for them the essential numbers of hospitals, hotlines, and toll-free numbers that the government's established to provide critical information in COVID-19. And what this means is that the girls, when they recognize that they're in trouble and they recognize that they're in need of some kind of physical or psychosocial protection, can immediately contact, in the first instance, their protection advisor from Street Child using a missed call service, and they will then immediately connect them to a life-saving service, or where possible, they can directly access that service themselves. These sorts of protection messages, again, in a very rapidly closing window of 24 to 48 hours, also went up all over the communities in one of the provinces that we work in. What this meant for us was being, as Street Child often is incredibly local, low cost. So we did handwritten posters. There was no time to print. Handwritten posters went up on posts all throughout the community to make sure that community members would have essential access to these services during the time of lockdown. What we're also starting to increasingly turn our attention to as schools shut down and as school closures extended across the communities that we work in, both at the local level and the national level, if we can just flip to the next slide, please, is thinking about ways in which we can continue providing life-saving, life-sustaining access to children And I can't stress enough with my head of education hat on that it's so critical that children have access to education, not even in emergencies, but especially in emergencies, because this is one of the critical ways that we can provide safety, security, and a sense of stability for students who often come from very challenging home and community environments. This is a photo from our program in Afghanistan, operating in Uruzgan, which is a Taliban-controlled or contested territory, where in a very rapid moment of change, we have now gone from delivering lessons in a learning center environment to our teachers safely looking to visit the students at home to provide some of these essential messages, not just to their students, but to the families and the siblings where possible. This includes heavy dosage of protection messaging about how to stay safe, to keep washing your hands, to maintain social distance. As you can see in the photo, the teacher is sitting at a safe distance away from the family, but also then to start to provide essential engagement activities that can keep children feeling stimulated, safe and secure to mitigate against a potentially huge risk of permanent dropout if we see these school closures start to extend. What we're now focused on as an organization is an incredibly exciting moment. And I say this because I do think there's a window of opportunity here for us to think about how some of these shifts can in fact help us build back better and create systems that actually start to extend out to most marginalized children who didn't previously have access to education in any case. We're starting to have some really interesting, exciting conversations about how we shift distance and remote learning, but again, within the incredible challenge of unbelievably low resource environments where our children, far from having computers or phones, often don't even have access to pencil and papers. And that's something that we're keen to continue talking to our supporters and donors about, and thinking about how we scale up as the circumstances keep evolving. Now I'm going to hand back over to Megan, who will talk us through the next two priorities.
Thanks, Ramia. So if we move to the next slide, we're looking at increasing coping capacities. Of course, we've seen unprecedented events, even here in the UK, where many families, people have lost their livelihoods, and the reaction to that has been, an enormous promise of a social safety net by the UK government, and many families in the UK, absolutely need that to carry on. But what we also recognise is that in the environments that we work, not only are those social safety nets not available, not going to be available, but that the families who might need them have very little in the way of existing savings or coping capacities themselves. So what this means in the context of COVID-19 is that in an environment of lockdown or quarantine, there is a serious risk of starvation. There's going to be an enormous recovery effort that follows the peak and hopefully trough this COVID-19 crisis to rebuild livelihoods. But right now, increasing coping capacities means protecting families from starvation. It's going to be emergency relief in the form of food or non-food items. We have to ensure that families in lockdown in countries without social safety nets don't starve. And just this weekend, our national partner in Sierra Leone, SCOSL, was engaged in a national effort to feed street-connected children, as you see in this photo here. That was only a 3-day lockdown, but already the most vulnerable are harshly highlighted by our need to distribute food, very basic food, just for 3 days so that street-connected children don't starve. I'm sorry to say that in Ebola, so many desperately needed this support and would have starved without the food that Street Child provided. And in the very early days, some did starve. So at the same time, as looking at livelihoods and ways to continue to invest in families' livelihoods where the social restrictions allow, and working to build resilience ahead of the crisis. In many countries, we're already shifting into relief mode to ensure that families can continue on through the peak of this crisis. So if we move to the final pillar of our global response, that's accelerating localization. So localization, one of those slightly sector terms, it really means empowering national actors to take the lead in their own development, and in this case, humanitarian response. Now more than ever, we have to work with national actors to combat the health and humanitarian impacts of COVID-19, because many international actors are now immobilized, literally grounded because of global travel restrictions, and many also have suspended or withdrawn operations, some due to decrease in funding. Others simply don't have the partner networks that Street Child does. So the sector's now waking up to the power of nationally led action. They're engaging in huge conversations about how to mobilize, activate, and empower national actors. But the good news for Street Child is this is how we work. This is how we have always worked. We've got 44 national actors across our 14 countries that we're actively engaged with, but we could engage so many more to mount national responses, regional responses. So we have separated this out as a particular priority of the COVID-19 response because we are so well placed to do this and because we see it as so critical. National partners have unparalleled access and understanding of their community's needs and will be absolutely central to Street Child's COVID-19 response. And we just have a picture here from Cameroon, where in the last week we've launched a rapid response fund. It's actually being co-led with a national partner that specialises in health and protection. Street Child and an organisation called LookMeth are administrating a small rapid response fund for grassroots community NGOs to get out there and do the mobilisation work in the way they see best. This is how we think the COVID-19 response should be run and can be scaled.
Thank you, Megan. Thank you, Ramya, so much for really bringing to life. And I just, can't say enough. My thanks to you and the teams that you lead, our staff and our partners around the world for all the hard work that has gone into the planning and immediately implementing the response that's been made possible with the generous donations of people on the call and others. So, thank you. If I may, I'd just like to reflect that, we think we're in this for the long haul. The humanitarian needs that Ramya has highlighted at the top of the call are going to continue far beyond the health needs. As Street Child, we are totally committed to being here and there for the long haul. I used to work for the British Red Cross leading their global disaster response teams, and I've been involved in sudden new emergencies and chronic long set emergencies. And I'm really proud of the plans that we're putting in place. We know we're going to need to keep scenario planning as things change. We're going to need to keep adapting and planning and implementing and testing and learning as well what's working, what's not working. And that the sort of feedback mechanisms we have from the communities, from our partners, will really help us in that, but also learning from other organizations at work in this space. More than ever, across the 14 countries where we operate, we're going to need to be really well coordinated. Tom, why don't you just sort of draw this all together, if you will, and then keep the questions coming. There's some great questions coming in already, so I'm really looking forward to the Q&A that I'll moderate after Tom's brought us together.
Yeah, Pete, thank you very much. Everyone, I hope I'm clearer this time. Get used to shouting at my computer in my living room myself. We've really been trying to convince you of two things. So the first thing is the most important thing, but I think the fact you're on this call already suggests that we don't have to do too much convincing, which is just that regardless whether it's with Street Child or whoever, the urgency of supporting Africa and South Asia now. I honestly believe every bone in my body, every hair on my head, that pound now is worth 5, 10, or any multiple probably down the track, because we still have that chance to minimize the scale of the issue by acting now. If you take nothing away from this, please take that away. Secondly, of course, we've been trying to explain, narrate why we believe at Street Child we have a really unique proposition. And I just want to draw the threads together on that in particular, because we have a huge amount of confidence in our ability to make a dramatic impact in the lives of hundreds of thousands, and frankly, hopefully, millions of people living in the world's toughest places, if we can access the level of support that we need. There are four unique advantages, certainly unique in combination, that Street Child bring. Firstly, experience we gained during Ebola. It's been referenced several times. Secondly, last point that Megan made, partnerships. Our approach of working, trusting relationships with local charities, 44 existing relationships in 14 countries, gives us extraordinary reach. And it is an approach which is common in the development sector. It's very rare in the humanitarian sector. Street Child is recognized at UN level as being an outstanding example of localized action in humanitarian emergencies. We're currently funded by UNICEF and Save the Children to conduct research and experiments in this field. We are uniquely placed because of our partnerships network and because of our way of working with partners in humanitarian situations. Example Megan cited from Cameroon there is really at the cutting edge of innovative humanitarian delivery. Thirdly, we are experts in the world's worst places. It's what we do. Others are adapting to this. Street Child works exclusively in the most acute development situations and in humanitarian situations, whether that's war zones, post-war zones, refugee hosting contexts. As Ramya said, we work in situations where the issue isn't that Abdul can't access a tablet or radio, it's that Abdul can't access a pencil or a piece of paper. Then we are experts in thinking through solutions. And there is evidence. A recent report that came out in January looking at our work in Liberia, which showed that Street Child outperformed 7 other organizations on delivering per impact per dollar spent. And by a very significant margin, we are experts in delivering something in very, very resource-constrained environments. Fourthly, generic core qualities of Street Child. Simple strategies, on scale, agility, reflective spirit. Just an hour and a half ago, I was on the phone to Kelfa Kagba, who is the leader of Street Child in Sierra Leone. And I was asking him how it had gone with the lockdown feeding we'd done. And he said, Tom, we had a problem after the first day. We realized that feeding 1,000, which was nearly 2,000 street children, we had real issues with social distancing, and that they were hungry and they're clamoring for us for food. We met as a team that evening. We devised a strategy. On day 2 and day 3, it was much better. Street Child is a reflective organization, and we are ambitious. And I just want to sort of finish on that note. We're not ambitious for ourselves. We don't matter at all. We're ambitious for what we know we can achieve on behalf of the world's poorest people we exist for. And that is why we are setting out, as Megan has trailed, in the next 7 weeks, our ambition is to materially reach 1 million people in the 14 countries we work with information and services, which will mainly be soap and water, will materially increase their degree of protection from COVID-19. We don't have resources to hand to deliver that. We are dependent on people trusting us to allow us to make that. But we absolutely have staff, the ideas, the delivery network to make that happen. I'm going to finish with one last reflection. And it comes from my most harrowing day ever working for Street Child. In a village called Pondu, just inside Sierra Leone on the Guinea-Liberia border. Pondu was the very first village to be hit by Ebola. I was there in November 2014. Pondu sits in Kisiteng chiefdom. I was there with the chief. He was telling me about how Ebola had made its way into Pondu and then from Pondu into the rest of the country. How shamed he felt by that this disaster entered into through his chiefdom. I remember his lament. He said, but if only we had known, only people had told us that this virus was out there, only people had told us how we could prevent it, the things that we all know now that are so simple. The way that Ebola spread through Pondu was through a funeral, where in West Africa, it's traditional and it's common to go and have physical contact with the body of the deceased, which is it's a very good way to get Ebola. That person has died of Ebola. Only we had known. Those words and the anguish of this man have actually hung my spirit for 5 or 6 years now. And this is really what is driving this appeal now. Because we know, we in the West know what Corona brings. We have the power to share that knowledge in a way that will protect communities and save lives. That is what we are asking our supporters to help us with now. To get this response moving, we are dependent on those that trust us, those that know us. I do believe that when we get going on scale, others will take note, as they did in Ebola. I remember basically being laughed at when we started our work in Ebola. I remember actually an organization which trusted us in one space, our work with Street Children. When we said we're doing all this sensitization, they said, not your thing. But we delivered amazing results. We will do amazing results again, and then people will get behind us and trust us. We do need to get going. And that is really our ask to you. About 3 minutes ago, I got a message up on my screen saying I had 1 minute left, so I have to end now. Thank you so much for listening to everything that I've had to say and my colleagues. Now there's a chance for questions. But I know many of you in the call have already pledged support. I'm just so grateful for the trust you put in us. And those of you who are considering it, I would just like to really promise that myself, my team, the leaders you can see on the screen, those beneath them in our ecosystem, will do everything plans according to our power to get the biggest impact possible. That is one solid Street Child. Thank you so much.
Great. Thank you so much, Tom. Thanks to all my panelists today. Guys, some great questions coming in on the Q&A. I'm going to say to the panelists, when I give you the question, I'm looking for 1 minute answers, quite short and to the point, please. And guys, if your question doesn't get answered today, please note that we will follow up with you, we'll reach out to you, and please feel that you can get in touch with us with any question that you have about this. Our aim and intention is to be able to do more of these kind of things in the future, give you much more of the inside track of what we're actually doing, and be honest with you about the challenges that we're facing and what we're seeing. We want to be really open and transparent with you. We want to share our learning. We want to share the things we don't get quite right as well and how we've learned from that and move forward. So stay as long as you can for the Q&A. If you have to go, then just thank you for being with us. But let's get into a few questions now. Megan, I wonder if I might kick off with a question from Jeff and Jill. How will we stop the risk of spreading the virus further if we're going into remote communities?
Yes, I saw that question, and it's one I was discussing with my Congolese colleagues just today. I'll probably kick off by saying that the fact that we work with local partners means we are naturally limiting very much the entry of new people into the community. We are prioritising working with people who are already there and embedded in the communities. That said, in Congo, we work in a remote area called the Plateau region, and we have to be so careful that we are not a vector of transmission when we carry those messages. And answering another question I think I saw on the Q&A, we are providing all of our staff, of course, with training in exactly the same prevention messages, and also protective equipment, masks, hand sanitizer, gloves, and making sure that they maintain social distancing even whilst they go and spread those really critical messages.
Thank you, Megan. I wonder if you might also just address a question that Ben had. You know, how is Street Child modifying our programs to adapt to the movement restrictions that we're seeing in many countries?
Yeah, indeed. And it's not just our programs, it's even our UK staff, because of course we're all shifting to remote working. And I think it's a new horizon for us, but also quite an exciting one as we start to explore the remote possibilities. We already work remotely in many ways. So I'm managing 10 countries across Africa. So I'm using digital means to engage with my colleagues. And in fact, in many ways, that nothing has changed in the way I'm engaging with them. However, out in the field, of course, there are huge consequences. There's a real range of situations across the countries that we're working with. Some have implemented very strict lockdowns for an indefinite period, only a couple, whereas others have imposed a curfew. For example, Kenya, you can still move in the day. It's only at night that there's a curfew, so quite a lot is still possible. We're really having to adapt to the restrictions as we see them. Although what I will say is that those are incredibly fast changing. So I just had a message actually from our country director in Liberia who says a 14-day lockdown has just been announced in Liberia with very little notice. And so we're having to put even more emphasis on those digital ways of communicating, but also really applying our creative and innovation hats to think, how can we use radio, TV, phone messaging to spread these messages even whilst we're not able to get out there in the communities.
Great, thanks, Megan. Ramya, can I come to you and pick up a question from Quinn? How is Street Child planning to incorporate community involvement and agency in the response to this pandemic?
Sure, thank you, Pete. Great question, and I think yet again, this really hinges on the ways in which Street Child has always worked and is very used to working. So Megan spoke a lot about localization and the ways in which we work with our national partners. That localization actually very much filters already pre-pandemic into communities where we have established community management mechanisms, for example, who support us on a day-to-day basis to deliver our programs, and who in this time of COVID are stepping up even more to support us with the dissemination of life-saving messages, coordinating with us, supporting us to reach out to vulnerable children and families in the community. It's worth mentioning that a vast majority of our teams on the ground come from those local communities themselves. So pretty much every teacher I can think of across the 14 countries that we operate in comes from the local community. A lot of our staff members on our national teams and are recruited and then trained from the communities that we operate in. So in a sense, we have a built-in infrastructure to be able to operate in this time of lockdown and movement restriction by putting even more autonomy and authority into the hands of those community members and really having them lead the response on the front lines.
Thank you, Ramya. Just someone commenting that we may have had a typo in the presentation on the target to reach that 1 million. That's by the 31st of May, not March 31st, which has already gone, just so you know and clear. Incredibly ambitious, but very powerful and motivating target for us. One we feel we can reach with the support of others, for sure. Tom, really great question about sort of what kind of, just get the question up properly in front of me. How do we expect to be working with other global organizations, UNICEF, other NGOs, and liaising with other governments? So that's something that Jean-Pierre is asking, and Louise. What are UK government, other global organizations doing, and how can we as Street Child work with UNICEF, other organizations, etc.?
Yeah, great questions. Some of the detail will be found out as we travel. Street Child has a very close relationship with both DFID and UNICEF. I can talk to DFID, the UK government's development arm. First, DFID are our largest funder. They are still working out their strategy in terms of supporting civil society organisations like ours, and they have made donations, contributions to the big global funds, which is great to see. However, those global funds are not fast-moving beasts, and they are red tape laden beasts, and so that money will take a while to trickle down, and it will come down in quite constrained packages. UNICEF are pretty sure probably our second largest source of funding in the last 2 or 3 years. In all the countries we work in, we are well known and interact frequently with the UNICEF reps. Something which occurs in every country is a coordination system. The different sectors, there'll be an education coordinator, a child protection coordinator, and so on. Generally, those coordinators are UNICEF or maybe another large organisation, Save the Children, often in education. And actually, charities, the major charities, are pretty good at coming together at those meetings, trying to divide the labour in sensible ways. That's geographically or thematically. Street Child participates in all of those meetings. And so that's a sort of a glimpse, although what I would say at this very early stage is that whilst in some of the humanitarian settings, like Nigeria, for example, where there's already humanitarian crisis, and they're grafting COVID in and starting to move. Countries where there isn't any established architecture, those coordination groups will still be setting up. That's all good and well, but that takes weeks. Really, COVID is moving. So this is a large part. It's a point that kind of Megan made. One of the values that we can bring now is getting going now. The big wheels will come into action. They will be impressive because of their scale. It will take weeks at best to really get going. Weeks in which COVID is moving very quickly. So right now, a large part of Street Child's value, and you talking directly to donors' wallets now, funds which are donated to Street Child today will be in action in the field next week. Funds which are donated to UNICEF, for example, are more likely to come into action in months to come. However, that money will be spent well when it is, and it will be coordinated. And as it being so, this isn't just a flash in the pan event. This will be a long haul. So it's a spread of comments.
Yeah, thank you, Tom. That's great. Ramya, do you want to just share some of your own practical experience of some of the coordination with others?
Yeah, absolutely. And I think I'll speak a bit to our coordination with other agencies. And we're finding really, we are very much committed to being radically collaborative at a time like this. And what that's meant for us is being able to really share our experience and expertise, particularly what's derived from Ebola, for example, with other agencies who are right now thinking, particularly development agencies, who are used to implementing programs but aren't sure of how to pivot given the particular kind of restrictions we're facing. And so just next week, we're going to be delivering, for example, a webinar for other international organizations, education organizations who are thinking, what does education in emergencies actually mean? And looking to support them to rethink their strategies around that. I also wanted to touch a bit upon is that we're not precious about creating things. Where we want our money and our effort in our agency to go is really on reaching the most marginalized, the marginalized of the marginalized. And if that means there's another actor out there in that space who's already doing something that we can take, but then very quickly adapt to reach the hardest to reach populations, then we'll do that. And so last night we signed an agreement, for example, with Rising Academies, a great education organization who work in Liberia and Sierra Leone, who are currently delivering a radio learning program, which is absolutely fantastic and is going to reach a certain percentage of the population. But we will then take their radio lessons and adapt them for the Abduls, as Tom mentioned, who don't have pencils and papers, who don't have radios, and think about how we can make the most of those resources for those particular children. So that's very much to say money invested here is really about taking it right to the edge, to the children who need it most, that currently aren't being served by other responders at the moment. And that's where our focus has always been and where it will continue to be throughout this crisis.
Thanks, Ramya. Jorge has made a great point about the need for local, national, regional response alone won't be enough. This real sort of local contextual knowledge being so important. And I hope we've spoken to that. We do agree how important that is, and we feel very well placed with our local relationships to make the most of that. Tom, I wonder if you would just speak, there's a question from Jeff and Jill around, are we able to give details of our budget? How much money, do we need? What would we like to raise? Would you like just to say a few words on that? You're muted, by the way.
Now you can hear me? Thank you. Two comments. One, on the immediate goal of reaching 1 million people in need in the next 7 weeks. At the moment, the price points on the proposals we're receiving internally from our partners and our country teams are being able to achieve reach for about £1 a head. We probably have access to about £250,000 at the moment from appeal funds donated to date and funds that we can repurpose from our existing funds and contracts. So that tells you that we are to do a good job to hit our target. We are looking for a healthy 6-figure sum in the next 5 or 6 weeks. So if that's a useful indication. Secondly, what I want us to do, and we're looking to set this up in the next few days, is really take our transparency about the funds we're receiving and deploying them to an entirely new level. We would like to essentially be able to publish an account, maybe at a realistic interval, perhaps a fortnightly, where we are documenting funds we are receiving, allocating them, how we are spending them. And so our donors can see, and then link through to that, what we're actually achieving with those funds. It's actually an idea which we've had in gestation for 6 to 12 months anyhow, around a kind of global rapid response fund, which actually is what this is. We didn't know it would come to light in these ideas in these times. So we're going to be tightening our thinking around that in the next few days, and then we'll release further details. But we really, as a matter of pride and respect to our donors, want to and believe it's entirely possible to give a very high level of transparency, an unusual level of transparency about how we're using those funds. So those are the two answers.
Great, thank you. Thanks, Tom. Guys, we're going to try and we'll wrap this up by 10 past the hour, just so that you know where we're going to come into land. So if you can stay with us the last 5 minutes, then great. Question from Joe. Megan, if you can, do we think these restrictions on movement and social distancing that we're seeing in, let's say, the West, are they realistic goals in higher risk areas? I mean, maybe in Ebola, people got used to that, but what about some of these other contexts?
Yeah, this is a question I've really been grappling with a lot as the management team at Street Child knows, because thinking about everything that's available to the global north, not just social distancing measures, but extended lockdowns, social safety nets, etc., are just not available in so many of the countries that we work. I think we will see a shift in strategy across a lot of our low-income contexts. I don't think we can see the kind of incredibly restrictive measures we've seen, for example, here in the UK. I don't think that they are possible to enforce. I think perhaps one strategy that might move to, and we might look to support further as we tailor our messages once, if you like, COVID-19 properly arrives, is shielding of very vulnerable populations and trying to really emphasise the message of who is most vulnerable to COVID-19. We're very worried about the what they call comorbidities. What will happen if HIV affected people, for example, would get COVID-19? Of course, we're worried about the elderly, as everybody is. So I think the answer is one size does not fit all, and there is a lot we still can do to enforce social distancing, even in a refugee camp. Recognise where large gatherings can be minimised, but I don't think that exactly the same as what has happened in, for example, UK or the US can be just wholesale applied, because we have to consider the indirect impacts of actions like that. And we'll be very much seeking to engage in that conversation in each country that we work in, and look how we can also adapt our messaging to make sure that the most vulnerable are the priority.
And Megan, I wonder if you could just say a word or two on what we know about the ability of national actors to access personal protective equipment, and perhaps how does that play out for Street Child staff and our partner staff?
Yeah, I mentioned that a little bit earlier. That is in every budget we are drawing up is protective equipment for our national staff, yes, but also our national partners. It is absolutely critical. And to be honest, a lot of the mobilisation and activation work we've been doing is to mobilise our national partners. They are afraid. They're afraid, like everybody else is afraid. And nurses and doctors might be on the front line, but just behind them, just one step behind them, are the social mobilisers, the ones we're asking to go out into the community. And so in doing that, we're trying to empower them with some of the information that they need about who is most vulnerable. So, making sure that amongst our staff, it's the kind of young and fit without the pre-existing health conditions that are going out there, that they have personal protective equipment that they need, and also that they really see the amazing value they can add to a national response effort right now, and see themselves as key workers, the phrasing we've had, key workers, frontline workers, that they have a massive role to play, because that's what worked in Ebola with our Sierra Leone and Liberia partners. That initial phase of fear, and then absolute determination and perseverance to go above and beyond, and do what was required really to protect their countries and their people.
Thank you, Megan. And so finally, there's been a question about, can we share the recording of this meeting, this time together, that others can use elsewhere? We'll work on that. I can't promise anything. We're not 100% sure whether the recordings have worked as intended. We'll have a look at it, but we'll reach out to you, those of you that are saying they would love to be able to share this elsewhere, and we'll work with you on getting you what you need so we can spread this message further. And Louise and Katie, and thank you for your offers. And Louise, you saying, look, can we help spread the word? The answer is absolutely yes. We'll reach out to you, and please, others, do get in touch with us. Ask us these kind of questions, give us these offers of support. It is massively appreciated. We've got material coming in, stories from the reality of the situation that our staff and our partners are facing, and we would love to be able to share those, and let's get the word out wider. I promised we'd land it there. Thank you, Tom, Rania and Megan. You've been brilliant. Thank you to everybody who's given up their time to be with us today. We really appreciate it. I think this has worked well. And as I said, we will look to set another one of these up in a little bit of time, and we'll continue to be real with you. We'll continue to be honest, and together I think we can have a truly incredible impact. So let everybody stay well, stay safe, and we'll speak again. Thank you and goodbye.
Thanks so much, everyone. Thanks, Pete.